Hi everyone and welcome to my channel. I'm Sonia and today we are talking kidney stones. So did you know that the largest kidney stone ever recorded was one that was more than 1 kilo in weight, 1 kilogram in weight, and was 17 centimeters wide in diameter? Well, that's a pretty big kidney stone. It's probably the size of a coconut. How that fits in a kidney, I'm not sure, but this is what is documented. So if you like information about health topics that are valid, reliable, then you need to subscribe to my channel because that's what I present to you. And of course, all the references are in the description box below. So don't forget to subscribe and of course do the thumbs up because everyone loves a thumbs up. It makes me feel happy when I see thumbs up. So what is a kidney stone, how it's formed, and of course the symptoms and how do you treat one? We're all talking about that today. So what is a kidney stone? Well, kidney stones, renal stones, the other big word for it is called nephrolithiasis, meaning renal stones. And it's a common problem worldwide with 50% of people who have kidney stones having another bout of kidney stones within 5 years. Sorry if you're one of those people. The peak incidence of actually having a kidney stone is between the ages of 20 and 49 years old, and it occurs predominantly in more men than in women. But all ages can have kidney stones, even children. So the rate of kidney stones has been increasing for the last 50 years, and it is thought that the reason why this is so is because of maybe the diet that we eat, our increasing obesity issue also puts us more at risk of having kidney stones. So that's what is thought as we get bigger, we get other areas of problems like cardiovascular disease, diabetes, and this puts us at more risk for a kidney stone as well. So we really want to try and keep our weight down. That's the honest truth. So a kidney stone is a hard object that is made from chemicals found in the urine. So the urine has lots of various waste products. And when there is too much waste and not enough liquid, what happens is crystals begin to form. So the crystals, say this is a crystal, it attracts other crystals going by or other elements, and they soon join together and they form a solid mass, which can be tiny little things, stones like gravel, they can look like, up to larger ones. Now, often these are passed and you may be none the wiser. However, if they're larger, then that's when they become a problem. So the stones that form the crystals or the crystals that are formed are actually from a number of different products. And these can be from calcium, from oxalate, from urate, from cystine, from xanthine, and from phosphate. And these chemicals are found in our urine and never pose a problem because, our kidney is the master filter system and usually can flush everything through. So if you're not drinking enough though, and you're not having enough liquid flushing through your kidneys, this is when you are more at risk of having a kidney stone. So after it's formed, the kidney may stay in the kidney. So it may stay up in the kidney, or it might decide to travel down out of the kidney into the urinary tract, into the ureter, and sometimes stones can move through, as I said, and not be a problem, and other times they don't, and they get stuck in the ureter, or it may be, in the bladder or the urethra, and that's when, you can get pain. So what causes them to form? Well, we did mention that, our larger population, like obesity, is causing more of a problem. Drinking too little water is a problem. Not people who exercise or don't exercise enough, who are using up lots of, who are sweating and not replacing their fluid and hydrating themselves, they're at risk. And of course, those who aren't moving enough, who are at risk of obesity and other issues, are also at risk as well. And then there's too much sugar and too much salt. So kidney stones also have frequent association with things like hypertension, diabetes and obesity. And one of the major factors that can either promote or inhibit kidney stone formation is what we eat and drink. And, people with kidney stones should be trying to drink at least 2 litres of fluid a day. Now, for some people, you will need more. And the easiest way to check if you are drinking enough fluid, and I'm talking water, I'm not talking soda drinks or coffee or cordial or anything else. I'm talking good old water. So if you don't like water, then maybe you need to try something like mineral water or soda water, but you need water or a very simple fluid. Nothing with sugar in it. And yes, so having water is the best thing, and it's free. So let's face it, our body is made up of predominantly water and it loves being hydrated. Next time you go to the bathroom, check out the colour of your urine. If it is yellow, or if it is bright yellow or dark yellow or amber coloured, you need to be drinking more water. So your urine should be the colour of light yellow, almost like less colour than apple juice, and definitely almost clear. And that is how you know that you are drinking enough. And definitely, if you have urine that is cloudy in colour, that is not normal. Okay, that could suggest that you actually have some sort of urinary tract infection and you need to seek help and get that sorted. It's thought that more than 1 in 10 people will actually experience kidney stones. And I know recently my brother-in-law had one and ended up in hospital overnight. I remember walking into my parents' bedroom, and my father was rolling around on the floor. And I'm thinking, oh my goodness, my father's having a heart attack. And he was just rolling from side to side on the floor. And I said, I was about 16 years old. I said, Dad, what's the matter? Are you okay? Have you got chest pain or something like that? And he goes, no, I think I've got kidney stones. Oh, and he was moaning and groaning. And my father never, well, he's not one to express his pain, and definitely he's not a wimp or anything like that. So, for him to be rolling around on the floor in severe pain, and, he was pale and sweaty, and I thought, oh my goodness, he's having a heart attack. But no, he was having a kidney stone. So that was the problem there. So, they are and can be painful. And, 10 to 20% of kidney stones actually need removal because they are either too large to pass or they get a little bit stuck. So if your kidney stone is about 4 millimetres, which is small, about 4 millimetres, you should be able to pass it. But if it's anything greater than 8 millimetres, it usually requires surgical intervention. And so let's talk about the symptoms. So what can you experience if you have a kidney stone? These are a few of those things. So you can have severe pain on either side of your back. So, on your flanks, you can experience severe pain and, it's really uncomfortable. You can have vague pain or like stomach ache pain. You can have blood in your urine. You can have nausea and vomiting, and you can have a fever and chills. And you can have urine that smells or bad or it looks cloudy. So these are all problems. And definitely if you someone who presents with renal colic, which is severe sharp pain in the flanks that lasts anywhere between 15 to 45 minutes and then becomes steady, unbearable, and it's accompanied by nausea and vomiting is a good indication. But remember, there are lots of other problems, like, that can be associated with stomach aches, backaches, all those things. So just thinking it's kidney stones would be wrong, and you need to be diagnosed well. So your clinician will send you for some tests, things like a CT, a KUB, which is the kidney, ureter, bladder X-ray, or maybe something like an intravenous pyelogram or IVP, they say for short, which involves contrast dye as well. So with those things, they can see where the stone is, where it's lodged. If your pain subsided, they may send you home and encourage you to drink plenty of water. If not, they may get you to come back in for some surgical treatment, and this can involve things like shock waving the kidney stone and causing it to break up and then be able to pass down through your ureter into your bladder and be excreted. Or it may involve something like a ureteroscopy, where a flexible cystoscope is passed up through into your bladder, up through your ureters and into your and actually blast the stone, grab it, and bring it back down. So it just depends on what's happening, where it's located, and how large your kidney stone is. Apparently there's a ride in Disneyland, Florida, on one of the roller coasters that is said to, in like 70% of cases, if you sit down the back of the roller coaster, I guess where the all shaking happens, that if you sit down there and go on that ride a number of times, that you can actually get rid of your kidney stones. Check it out. So if you're not in America or Florida and can't get on that nasty roller coaster, then you might have to seek medical advice. And I advise that you do if you have such a problem. So how do we prevent kidney stones? We drink enough fluids to keep us hydrated. And, the colour of our urine is a good indication of how hydrated we are. So drinking enough helps flush everything through the kidneys and stops those crystals from forming in your in your kidney, in the first place. So that reducing your salt and your sugar intake. If you're overweight, definitely getting back to a normal weight. So check out your BMI. If you don't know, check out one of my clips, which is on how to work out what your BMI is and what you should be. And definitely restricting your animal protein, because it also has the protein in it has elements that will increase your risk of kidney stones as well. So I hope that has been helpful for you today. As always, I love presenting information that can be helpful to you, and that is my aim of this whole channel. So I hope you enjoyed today's topic on kidney stones, and I will see you next time. Bye for now. Have a great day.